So thanks very much, everybody, for coming. I'm just going to do some introductions first. My name is Louise Henstock, and I am the Directorate Lead for Teaching and Learning at Salford University. And I'm just going to hand over to my colleague, Jill, who's going to introduce herself.
Hi everyone, I'm Jill Rawlinson. I'm the Director of Allied and Public Health at the University of Salford and been involved in this work around enhanced practice. I'm also a CSP Council member, just so you're aware. Jo, do you want to go next?
Hi, I'm Jo Jennings. I work at Coventry University. I'm a course director in frailty and rehab at Enhanced Practice.
Anita? Or you're on mute.
There we go. So I'm Anita Watson. I am, well, a few more days left of the role at the CSP. I've been looking after the NHSE Commission at the Chartered Society of Physio, and I'm here to support Louise and Jill in terms of the webinar they're presenting today, and of course APPN. So thanks for joining us.
Thanks, everybody. So we're just going to do a brief overview of what enhanced practice is, what the need is for enhanced practice, sort of the journey of development so far. We're going to talk a little bit about the national schema and profession-specific curricula and introduce you to that. Talk about the different routes for delivery and the clinical practitioner apprenticeship at this level. A little bit around work-based learning and mentorship, and then sort of what the next steps are and what might be happening and what to keep your eyes open for. We're going to have a Q&A at the end, so if we could hold questions until then, and we've hopefully got time for a rich discussion for those of you who've got lots of questions to ask, that would be great. So what is enhanced practice? Enhanced practice is a level of practice that occupies the space after preceptorship, but before advanced practice. And it might be considered a destination in itself, or it might be a precursor to advanced practice. And it's really seen as the middle sort of workforce, and that's key to improving sort of the delivery and career pathways for allied health professionals, and really sort of realising the mix of profession-specific skills to that's found within sort of health and social care. So what's the need for it? So from the long-term plan, and also more latterly the NHS long-term workforce plan, it really identified the need for improved career pathways for staff, and also with associated funding for education and training. And we're going to talk about the funding a little bit with the apprenticeship as we go. So this level of practice already exists in the workplace. This is not something new, but what this does is it looks to formalise and recognise in it, and that's really trying to help to drive cultural change and try and provide a positive impact on health services. There's no generic enhanced practice role, and it's not an occupation, so we won't be seeing it after the title of people's job roles, and it's a level of practice. So just sort of something about the journey so far. In 2022, the NHSE, or as was HEE, launched a programme of work to develop a national schema and profession-specific curricula. And that was to really look to provide a robust profession-specific framework for professional development postgraduate. And it's also trying to think about the career pathway, but also helping to contribute to the retention of that middle workforce, and really trying to harness the full potential of AHPs in delivery of health and social care across all systems. It's based around the enhanced clinical practitioner apprenticeship that was approved in 2021. So that was what we had to work with. And Salford University went into an innovation partnership with Coventry University and were successful in commissioning enhanced level practice schema and curricula to develop those across the 7 professions, AHP professions there. And we're subsequently just about to deliver on another 2 AHP professions, which is for the British Society of Orthoptics, a British and Irish Society of Orthoptics, and speech and language therapy. So the Enhanced Practice National Schema and Profession-Specific Curricula is a really big weighty document. We were hoping it might be split up when it was put online, but it is an extensive document. So I thought it'd just be useful to kind of break it up a little bit. The front bit is the schema, and that's kind of the overarching principles and high level sort of thinking around what the document is around. It includes things like the purpose of the schema, the teaching and learning and assessment principles, and also things around EDIB that should be running all through this, and also work-based learning requirements. And then after that sort of front section, there's almost individual chapters which are aligned to each profession. So physiotherapy has its own section and profession-specific curricula. And each of those sections for each profession is laid out in a very similar format. So if you look at one, you'll see the same format repeating itself. So for physiotherapy, there is a section around underpinning the development of the curricula. There's understanding and how to use the curricula. And then it's linked and mapped extensively to the national frameworks and capabilities that are currently available. And also then it's developed around this framework, which we developed around 4 pillars of practice. And that's the enhanced practice domains. And there's different levels of those domains as you have a look at the framework. And this is an example. So what we did when we developed this was we had wide, extensive national consultation across all stakeholders, all levels of practice, and across all sectors, and that was including the professional body. So the CSP were really involved with this piece of work. And we developed core principles across the 4 pillars of practice, mapping to the apprenticeship standard, because that's what was already there, to meet the requirements for each profession. So they were really profession specific in terms of the development. They were mapped to the frameworks and capabilities that are available. And then once we developed those, they were then extensively checked by other HEIs, professional bodies,
here because that's no signal.
And specialists in practice. Jill, you've got your mic on. So then thinking about the routes of delivery, there are several routes of delivery, so options that we can take. Just to say, in terms of the level of delivery, the apprenticeship standard for enhanced practice is written at level 6. So that's academic level 6 study. But with any apprenticeship standard, you can deliver that the level above or the level below. And as part of that national extensive consultation that we talked about, including the professional bodies and in conjunction with the professional bodies, it was decided that for physiotherapy, this would be or should be delivered at level 7. And that's because all of our workforce are already at level 6 when they reach that preceptorship standard. And that's not always the case for all AHPs and other professions that the apprenticeship standard is applicable for. So there's 2 routes there. If you see, there's the apprenticeship route and then there's the CPD route. And that is entirely HEI's choice whether they want to deliver those, and people's choice whether they want to go down those options. So the apprenticeship route will obviously include the endpoint assessment. It's a non-integrated endpoint assessment, which means it sits outside of the study at a HEI. Or the CPD routes. Some people may not be interested in doing the apprenticeship route. They might want to use CPDs or other monies that they have access to. And also within both of those, there is an option for credit bearing or non-credit bearing. So by credit bearing, what we mean is you can acquire the maybe 60 credits at PG cert level and get your certificate from HEI, or you don't have to do those assessments. That's not necessarily part of what this has to be. And some people will be interested in doing that and others may not. So Jill, am I okay to hand over to you? Do you want to do the apprenticeship bit or do you want me to carry on?
Yeah, no, I'll take over now. Sorry, I just had to move location. Apologies.
Just let me know. Let me know.
Yeah, will do. I'm hoping my sound's okay and you can hear me, but if not, take over, Louise, please. So as Louise said, the only guiding document before the schema and curricula were developed was the Enhanced Clinical Practitioner Apprenticeship Standard. And this is written as a level 6 standard, as Louise said. And with all apprenticeship standards, if you're familiar with them already, you've got a set of duties and then you've got a set of knowledge, skills and behaviours that we talk about in the sense of KSBs. And you can deliver an apprenticeship in different ways, as long as we are, as providers, compliant with the different bodies that regulate, including Ofsted and an organisation called IFA. It can be offered in different flexible routes. And apprenticeships obviously are based around work-based learning. They are for people already in the workplace in a role, and we can really think about how that person needs to develop, whatever setting or sector they work in. They can use the apprenticeship to develop their skills, knowledge and behaviours in line with their specific employment, as long as they can show that throughout the apprenticeship they are meeting and developing those knowledge, skills and behaviours, and really importantly, as they're going through the apprenticeship, they're embedding them into their work all of the time. So it allows us, because it's a multi-professional standard, it's not specific to physiotherapy, it stipulates that you have to be a registered or accredited health and social care practitioner, but essentially it allows different professions to undertake the one standard, including physiotherapy. Next slide, please, Louise. Brilliant. So it was approved back in May 21, and it's anyone that's using the apprenticeship will be able to draw down funding from their apprenticeship levy. So most of our health and social care organisations will meet the threshold to need to pay into the levy. So you draw down the fees. It's got a specific funding band of £7,000 that's provided to the delivering the institution that's delivering it, which is relatively low amount of money. But as Louise said, it's not mandated that you have to have an award, but some universities are deciding to offer an award to go alongside it. But essentially, what the learner must develop are the KSBs alongside that. And it's what we call a non-integrated apprenticeship. So it means that at the end of the apprenticeship, or close to the end, once you've met and shown that you've met the KSBs, you go through a gateway, and then you can enter the endpoint assessment period. And an external endpoint assessment organisation will need to undertake that, who is independent of the academic or institution that's provided the learning. So all apprentices have to spend a minimum of 12 months on programme, with a minimum of 20% off the job training. So as I say, you can be flexible in how you deliver it, but it will be a minimum of a year-long programme. And the EPA, the endpoint assessment, which I mentioned, is 2 pieces of work. There is a quality improvement proposal report with a Q&A section, and there is also a professional discussion or viva, which is underpinned by a portfolio which you develop over the course of the programme, and then you'll be questioned on some specific aspects of that. So, as I say, that's undertaken by a separate independent endpoint assessment organisation. The apprenticeship standard has just had some of its very first graduates. So we're just starting to really learn how it's developing, and we will continually review that as a group of people delivering it to ensure that we keep it as fit for purpose as possible. Next slide, please. And of course, you can look at all apprenticeship standards on the Institute for Apprenticeships website. So if you want to go on there and have a look about how it describes enhanced practice and what the KSBs are, that's where you will find it. Now, of course, because this is an apprenticeship, it's absolutely essential that you have a work-based mentor. Apprenticeships are sort of delivered on the proviso that you have this very strong relationship in what we call a tripartite relationship, exactly the same as the advanced practice apprenticeship in the way that it works. But you've got that work-based mentor that needs to support the apprentices in attending progress review meetings, which have to be a minimum of every 12 weeks, being a role model and helping them really grow and develop as an apprentice through the period of the programme. And they will be supporting them in their development and really helping them reflect on and map their learning that they've done off the job into the work. And so this is really going to benefit employers, because you as an employing organisation really drive and direct the learning and how that's applied in the workplace. They may also have a clinical supervisor who plays a slightly different role, and that will be very profession specific and perhaps really relating to the clinical area of practice. So they may have both of those, but they will have to have a work-based mentor that's constant throughout the whole apprenticeship. And we know that the Centre for Advanced Practice workplace supervision guidance really outlines those clear principles, and we can use those in exactly the same way in how we're going to support enhanced practice learners. Next slide, please. And so for us to have really successfully roll out and deliver this programme of work, NHS England have just funded 6 universities, a commission to really pump prime, I suppose, the rollout and delivery of enhanced practice nationally. So that's really about us working as universities to support educator capacity, those educator and mentor skills and understanding about what the educational requirements are of apprenticeships and how we can best supervise and support learners in practice. Because we know that when our first enhanced practice apprentices are out there, we want them to have a really good experience. We want the system to understand what enhanced practice is, what it isn't, and how they can be supported. And we need to think about how we develop a supply pipeline. We've also got our advanced practitioners, obviously, in the workplace and developing, and we need to think about how we also support this level before and ensure that we have enough mentors and supervisors to take those through. We've been hearing a lot about changes in the government around apprenticeship funding, and we're awaiting full confirmation of the new body that's going to oversee apprenticeships, Skills England. We've only had sort of preliminary information. We've also heard a lot of rumours, but we're 99% sure that they're going to defund level 7 apprenticeship, so master's level standards. So because this standard is written at level 6, we're pretty sure it will be exempt from that, and we will be able to seek funding, because if any university decides to deliver at level 7, it will be at their cost to do that. We've developed at University of Salford, we've worked with the CSP to develop some personas for physiotherapy, and I know they're going to work on those to turn them into animations to help bring to life who this level of practice is for, how it will be realised in practice. So we really understand that this is quite a new concept. I think, as Louise said right at the beginning, this is not a new level of practice. There are loads of people who are specialist physiotherapists in certain areas that are working at this level. And a bit like we had with advanced practice, they might have been really clearly there in the clinical pillar. It's about that 4 pillars at enhanced practice. So working, but all really relating to that, their workplace clinical role. So can they lead their service well and lead others in their team? Can they evaluate and research their service, ensure that it's evidence-based, it's based on a best practice guidance? have they got the data and outcome measures to show its value and impact for our populations? And are they developing their education skills to support the education of patients, service users, themselves, and perhaps those in their team that they manage and work with, including our support workforce, of course, and pre-registration learners in their teams. So very much that 4-pillar flavour, but at that working across those pillars and the intersection of those pillars. And also, we know that a lot of the questions you've probably got, and we know that we haven't yet got all the answers, but there's lots of discussion, is looking at the intersection between enhanced and advanced. So as Louise said, we want to celebrate this as a destination in itself, becoming an enhanced practitioner in physiotherapy. And that's fabulous. And a lot of our workforce will stay at that level. However, some will want to go on to advanced practice. And what we need to really recognise is how we transition learning and that step up from enhanced to advanced, and how that also intersects with educational level of training in terms of if they've got some level 7 credits from this level, how do we recognise those through recognition of or accreditation of prior learning, which is an educational part of the jigsaw that we need to sort out as HEI. So still lots of conversation going on in that space, and certainly something that APPN should be very involved with, I'm sure, as well. So I'm going to stop there because that's lots of information, and we want to provide lots of opportunity for you to ask questions. Louise and my details are there, so if you've got questions today, it'd be great for you to ask them and let's have some discussion. But if you've got any questions afterwards or you'd like to contact us, then please do so. So I think we will go to questions, if that's okay.